My name is Gideon Ndambuki. I worked as an IPC coordinator in Kenyatta National Hospital. I will talk about healthcare worker safety within healthcare settings. Why the concern of healthcare worker? It's because within the healthcare settings, biological hazards exist. These biological hazards can be airborne. They can be contact pathogens. Some of the airborne pathogen includes the pathogen that causes tuberculosis. The pathogen can also be blood-borne pathogens, and others can be body fluid pathogen, especially the pathogen that causes hepatitis B, hepatitis C, and hepatitis C and HIV. Healthcare workers are at risk of infection from accidental exposure to such biological hazards. Healthcare workers need to prevent themselves from exposure of such from when they occur. The component of infection and prevention control in staff health. 1, there is the rational use of PPEs. There is the post-exposure prophylaxis. There is periodical medical examination, screening, and vaccination. Education and training on IPC principles, guidelines, and standard operating procedures. Rational use of personal protective equipment. What is a personal protective equipment? It is a specialized clothing. All equipment worn by a healthcare worker for protection against infectious materials. The goal of rational use of personal protective equipment is to ensure healthcare workers are protected from exposure of the biohazards while they are working within the healthcare environment. Factors influencing the selection of personal protective equipment include the type of exposure anticipated. For example, you see whether it is the splash versus touch. Then one of the things that can influence the selection of PPE is the category of isolation precautions, the durability and appropriate for the task. The PPE should be fitting, and decisions about PPE use are determined by the clinical interaction with the patient and the risk assessment. There are different types of PPE used in healthcare settings. For example, we have the gloves that protect our hands. We have the gowns and the aprons that protect our skin and our clothing. We have the mask and the respirators. The mask protect our mouth and our nose. For example, during the era of COVID-19, there are different types of masks. There are the cloth mask, there are surgical mask, and there are the respirator mask. Now, what is the difference between these, especially in the pandemic we have? Cloth masks are recommended especially for the public and the community, because when you are in the community, the risk of exposure is much reduced. Then we have the surgical mask that is recommended for healthcare workers. Why is a surgical mask recommended? It is very effective against droplet precautions. It has 3 layers. It has the outer layer, which is water repellent. It has the middle layer. The middle layer acts like a filter. And we have the inner layer that is absorbent. So when the surgical mask is well worn, it ensures that the healthcare worker is protected even if he is interacting with a patient who is COVID-19. According to WHO, 95% of protection especially during the era of COVID, it is achieved. Respirator mask during this era of COVID-19 are used especially when there is aerosol, where procedures that are producing aerosol, like open suctioning, resuscitation, intubation, extubation, and dental procedures. We have the goggles that protect our eyes. We also have face shield. Face shield protect our face, our mouth, our nose. But during this era of COVID-19, goggles and face shield, they are not so effective. When the first time COVID-19 was announced, we had not, the researchers had not understood the mode of transmission very well. And that's why the conduct precautions were applied, where one was using a full body suit, he was using N95 mask, gloves, boots, goggles, and eye shield. After research have been done and the evidence released, and according to WHO, what we need to be using when we are managing COVID-19 patients, we need to have a good surgical mask with the layers I have talked about. Wearing of two surgical masks during this era is not recommended because it leaves a vacuum where air can be breathed in, and during the breathing in, you can breathe air that is not filtered through the layers, hence exposing yourself. If you're wearing N95, the N95 should be well fitting. And the challenges sometimes we are facing with the N95, it is because sometimes it is not well fitting depending on the size and the shape of the face. There are some of us and some of healthcare workers who wear double surgical mask. Others they wear N95 and a surgical mask. That one is not effective because the N95 it has 4 layers, others are 5 layers, and a surgical mask are 3 layers. If you combine those, they will be 8 layers. That means the body will not be acquiring the adequate airflow of oxygen. And then for the body to adjust, it has to employ an adaptive mechanism where we will breathe through the nose, through the vacuum above the nose, and hence breathing unfiltered air. That means you are exposed yourself. Then airborne precaution, N95 mask. I've talked about that. And airborne N95 is best worn when we are managing a patient with TB. We have data has been released that COVID-19 is a droplet precaution that need to be employed. Post-exposure prophylaxis. What is a post-exposure prophylaxis? It is the use of therapeutic agents to prevent infection following exposure to a pathogen. There are different types of exposures. These exposures include percutaneous, that for example needle stick injury, splashes, and even bites. For healthcare worker, PEP is considered for exposure to HIV and hepatitis B. When you are using post-exposure prophylaxis, time is of essence. Why do we say time is of essence? PEP should be initiated as soon as possible, preferably within hours, rather than days of exposure. PEP guideline states effectiveness is not achieved after 72 hours after the exposure. The steps after needle stick injury. The first aid that need to be employed. If the pathogen you have contaminated the skin with blood or body fluid, what should you do? Wash the area with soap and clean water. If the contamination is with your eyes, with blood and body fluid, what should you do? Irrigate the eyes while open with adequate amount of clean water. If the contamination is in your mouth with the blood and blood fluid exposure, what should you do? You split out any fluid, rinse the mouth with adequate amount of water. In case of needle sticks or sharp injuries, what should you do? Flush the area with good amount of clean water. And if saline is available, use it. One thing you need to note, do not squeeze the area. Allow the site to bleed freely. First aid exposure to mucous membrane or non-intact skin. Flush the exposed mucous membrane of the eyes and mouth with water. If again saline is available, flush with it. Do not use caustic agents, for example, disinfectants, spirit, antiseptics. Immediately inform your supervisor so that you can be released from your duties to go and obtain the PEP services. In case of penetrative injury, the first aid, what should you do? Wash the area with exposed to potentially infectious fluid with liquid soap and running water. A key thing you need to note, in case of these injuries or accident occur, do not squeeze the injury at that site. Then after the first aid, report the injury to your immediate supervisor who records it in the incident register. Why is it important to report it to your immediate supervisor? So that we can ascertain the area, the specific clinical area where the injury has occurred. So that you should not probably injure yourself outside your clinical area, and then probably you report about the injury. Immediately after reporting to your supervisor, then you need to be initiated on PEP drugs. And this, as highlighted earlier, should start immediately or within 72 hours following exposure. And every hospital, every healthcare area should have a place that is known by all staff where they can get the PEP drugs. Then after you receive the PEP drugs, the healthcare giver who has given you the PEP should document them well in the PEP register. Then vaccination is important, especially hepatitis B as a booster, especially for those who have had the 3 doses. Then follow-up to evaluate your progress should occur at least 3 months and then 6-month interval. Periodic medical examination and screening is important to healthcare workers. And why is it important? It's because if there are changes in their body and that they have had infection, the early management can be initiated. What do we mean by early management that can be initiated? We need to advise others depending on the situation, whether they need to take a medical leave or they need to change from one station to another. Then this helps also to prevent from the spread of infection from your colleagues and also from the patient and also the community. Advice on other interventions such as vaccination. Why immunization of healthcare workers is so important? It is because healthcare workers are at significant risk for acquiring or transmitting infection. Healthcare workers, they are working in highly infectious areas, and then they need to be immunized with the necessary vaccines. Also, why is it important about healthcare worker immunization? Infections are introduced or propagated by infected healthcare worker, and then this can lead to a large outbreak. Then asymptomatic or minimally symptoms patients may also transmit the infection to the healthcare worker, and the importance of immunization of healthcare workers. Vaccination against hepatitis B is key. And why is it virus of concern? 1, the virus remains infectious for a prolonged period of time, even on environmental services. Even after cleaning, if the cleaning is not done thorough, then the virus may remain on the environment for a long time. Number 2, why the virus is of concern, that is hepatitis B, it can be transmitted even in the absence of any visible blood. And then the transmission risk of hepatitis B is over 100 times greater than the HIV. And those who have been infected by the hepatitis B, they become carriers. And that's why vaccination against hepatitis B is of great concern. This vaccine is given in 3 doses, at 0, then at interval of 1 month and 6 months. 0, 1 month, and then there are 6 months. The doses are given at that interval because they produce a booster and want to achieve maximum protection against hepatitis B. For example, the first dose, it gives a protection of 30 to 55%. Then the second dose, it gives you a protection up to 75%. And then the final dose, it gives you a protection against hepatitis B over 90%. So that is important. We adhere to the protocol and the guideline of vaccination against hepatitis B, 0, 1 month, and 6 months. Then we have the COVID-19 vaccine. The COVID-19 vaccine, the currently that we are using in this country is a viral vector vaccine known as AstraZeneca vaccine or the Oxford vaccine. What do we mean by viral vector vaccine? It uses a relatively harmless virus. You modify to deliver the SARS-CoV-19 genetic material. Then the virus delivers it to the body cells. And that virus that delivers the genetic material is the one that is called the viral vector. When it delivers the genetic material, it interacts with the body cells to make a specific COVID-19 2 protein, which is recognized by the immune system to trigger a response. This response builds immunity, and when it builds immunity, it keeps the memory. So once you are infected with the actual COVID-19 virus, then the body helps to fight against that virus. So the efficacy of Oxford vaccine, it provides 70.4% efficacy against symptomatic COVID-19 infection. And once you have gotten the COVID-19 vaccine, it does not mean that you won't contract the disease. You may contract the disease, but what happens, you won't get the severe case of the COVID-19 disease. So everyone, those who are able and healthcare workers, need to be vaccinated against the COVID-19. And that's why we are insisting, once one has been vaccinated, you continue applying the other standard precautions, like social distancing, the use of mask, and hygiene, and the other related standard precaution. As I finalize and as I conclude, all healthcare workers need to be trained, and the training should focus on IPC guideline, emergency management of exposure to biohazard, proper management of infectious healthcare waste, management of highly communicable agents such as Ebola, proper handling of infectious specimens, then safe worker practices, and finally healthcare workers need to be trained on how to report on work-related infections. So as I conclude, healthcare worker safety is optimal in healthcare setting to provide optimal healthcare worker safety and to avoid transmission of infection from one person to another. Thank you.